Austin is taking a new approach to mental health crisis calls. City launched a 6-month pilot program last month that brings together police, paramedics, and mental health clinicians to respond jointly to severe psychiatric emergencies. Now, the Austin Field Integrated Response Support Team, or FIRST, operates in downtown 4 days a week, focusing again on high-risk situations. Dr. Mark Escott is the Chief Medical Officer and EMS System Medical Director. Dr. Escott, thank you so much for joining us today.
It's a pleasure.
We appreciate your time. It's been about a month since this program started. How's it going so far?
It's going very well. The team has been busy. They've been interacting with patients, and we've seen great outcomes in terms of the disposition, really trying to avoid taking people to jail, taking people to ER when there are other alternatives for them.
Getting them treatment. So how many calls are we talking about?
On average so far, it's only been about 5 or so a week. There's been some variations, but these are luckily uncommon types of emergencies. When they are not responding to those high acuity calls, they're also there to support EMS and APD teams responding to the lower acuity ones.
So walk us through how this is different from the traditional response approach.
So the traditional response approach for high acuity situation involves law enforcement responding first, stabilizing the scene, and then bringing in EMS and integral care. This deploys them all together so that in those high acuity situations, they have better ability to de-escalate and to hopefully achieve better outcomes than if they're down the street waiting for law enforcement alone to resolve the situation.
Now, Austin already has mental health clinicians working in the 911 call center. So how does this pilot build on that?
Well, that has been incredibly successful. A significant majority of calls that go to that mental health line can be resolved without law enforcement or EMS. So this is going to work in collaboration with them. They are looking for calls that would benefit from having this team, as well as the APD dispatchers and EMS dispatchers.
So what happens at the end of the 6-month period? I'm assuming you guys do some analysis and then decide what?
We're deciding, number one, should we continue it? And number two, should we expand it? Again, this is one team located in downtown.
Right.
We've already identified the need for them in some circumstances to respond outside of that George sector of downtown, which they have done. But as we grow, how do we do it responsibly in terms of efficiency of resources, but also the efficacy for the community?
All right, Dr. Mark Escott. Anything else viewers need to know about this new pilot program?
Again, it's there in the community Monday through Thursday, and they access it through 911. There's not a way to call them directly. Our hope is that they will continue to be utilized more frequently, and that we can see better outcomes for patients experiencing a mental health crisis.
Dr. Mark Escott, thank you so much for your time.
Thank you.